Hi everyone, welcome back to part 2. So we're now looking at how to break that cycle. We've just looked at the cycle and how OCD maintains itself. We now want to know how to break that. We know what the problem is, that's great and really helpful to reflect on that, on our own experiences, but how do we go about changing it? Now, before we do go on to that, I want to make it really clear that we are not asking you to make these changes straight away. The purpose of these videos are to educate, to provide information about OCD, to encourage reflection, but also to start to, I suppose, come round to the idea of how we would support you using CBT to make a change to OCD. If we're more informed, if we have a better understanding of what that involves, we are then in a better position to make that change in the future with support. It also will slightly, only but slightly, but make it slightly easier to make that change as well. I suppose if it's less shocking, if we know exactly what we're being asked of, then that just makes the process just a little bit easier and a little bit more effective, the likelihood of effectiveness increasing. So that's what we're doing here today. We're not asking you to make any changes, but to potentially reflect. The only thing is to potentially reflect on some of the changes that you might be putting in place in the future with our support. So, first of all, and I'm going to break this down, but first of all, intentionally, we need to trigger our obsessions and stop the avoidance of the intrusive thoughts. So if you think about it, if the intrusive thoughts are what are causing the anxiety, in order to challenge that and to put in coping strategies, we need to intentionally trigger that obsession. If I was riding a bike, I wouldn't just stand and look at the bike and work out how the pedals work. I need to get on the bike and cycle. So it's exactly the same sort of element. Need to trigger the obsessions in order to use the techniques to challenge them. And I then need to stop avoiding altogether the triggers for the intrusive thoughts. Because at the moment, if I'm avoiding the trigger, well, I'm not feeling anxious. So I don't need to put any of these in place. But the anxiety will always be there just in case on that one scenario we're not able to avoid something. We can't predict everything in life, and so there's always going to be something that's going to trigger that intention, that intrusive thought. So by stopping avoiding, first of all, we start to challenge straight away, but we also are more likely to trigger our obsessions, which means that we're likely to be able to put these coping strategies in place. Number 2, we resist the urge to perform our usual compulsions. So we cancel out the compulsions. We stop doing them. When we feel that, when we've triggered that intrusive image or thought, and we have that anxiety, we do not practice those compulsions. We no longer encourage or perform that short-term relief. We stick with it, stay with that anxiety. We will feel, or you will feel, strong, unpleasant feelings of anxiety, disgust, shame, or any other feeling that comes with your intrusive thought. I'm not going to sugarcoat it in that this isn't going to be a comfortable experience. It's going to be difficult because you are intentionally triggering that thought that is causing those unpleasant feelings. However, we need to allow this to happen to stop it. Allow this to happen, don't do anything, we stop it. We learn. We show, I suppose, these feelings show us that OCD treatment is working because we have to sit with them. And actually what we'll start to measure is the more that we put these change methods in place, the less each time that we do it, we learn that actually I'm more capable than I gave myself credit for, that actually this thought might not come true. Maybe it's not as important as I thought. Therefore, the anxiety reduces the next time we intentionally trigger that obsessive thought. It doesn't happen that quickly, but that's the ultimate goal of this. So we intentionally trigger our obsessions, we stop the avoidance, we stop the compulsions. Yes, that's going to make us feel uncomfortable, but that's good. If we're feeling uncomfortable, if we're feeling the anxiety, that's a good thing because it means that we're starting to approach it in a different way that might be able to break the maintenance cycle. So here's our cycle that we had. We've just looked at this, different elements. So with that in mind, breaking the cycle, we need to intentionally trigger intrusive thoughts and stop avoidance. So we cancel that out. We also drop all compulsive behaviours, including mental behaviours, and asking other people to do behaviours for us. That can be really tricky because it's very difficult to stop those mental compulsions in particular, because they are very automatic for us a lot of the time. So we acknowledge that, we know that, but again, this is just getting our heads around the fact that we need to stop it. We also need to involve those other people that are currently maintaining our cycle to ask them to stop doing that reassurance, stop helping us to avoid. And then we cancel out and we reevaluate the accuracy of our beliefs, that the intrusive thoughts are important or meaningful. If we intentionally trigger intrusive thoughts, we stop avoidance and we stop the compulsive behaviours, we are then left with sitting with the anxiety and finding out once and for all if that thought is actually going to come true, or if it is true. We also learn that we're more able to cope, that we can deal with that unpleasant feeling. And also, if that thought is unlikely to come true, and actually we know that the anxiety or the unpleasant feeling reduces over time, then maybe that thought isn't as important, isn't as meaningful as I initially thought. That's what we're ultimately trying to learn. We're trying to take the power out of that intrusive thought, so that when we have it in the future, when we've put this into practice and we've really, really practiced it a number of times, when that thought comes back into our minds, if it ever does, it's no big deal. It's just a thought. It doesn't mean it's fact. Easier said than done, I appreciate. But this is what we're aiming to do with the technique. So this technique of doing these three elements is called exposure and response prevention. Slightly easier way of saying it, ERP. So we intentionally trigger our obsessions and stop avoiding. That's the exposure part. So we expose ourselves to things that will trigger our obsessions. We expose ourselves by stopping avoiding. So for example, if we are staying indoors and avoiding children, then we go out and walk and see if we come across a child at some point. It's likely to happen. If we're currently avoiding touching all objects, we start touching objects to intentionally trigger that obsession. We then resist the urge to perform compulsions. Our anxiety will naturally rise and fall. We are not, as human beings, we are not, I suppose, beings that are able to experience anxiety at those peak levels for very long at all. We're just not built to do it. So we learn this. We realise that actually anxiety naturally rises and falls. We recognise that flow of anxiety, and therefore I probably can deal with it longer than I realised. This is where the response prevention comes in. So we prevent that compulsive response, and that will include other people as well. Cancel these things out. We start to learn then that the intrusive thoughts aren't as important and often don't come true. So that's the first really important part of it, is that if we do cancel it out in this way, if we expose ourselves and we prevent the response, we are able to learn that the intrusive thoughts aren't important. They're not likely to come true, so I don't need to spend time worrying about it. You may still notice unpleasant feelings, especially at the beginning when you start to trigger these intrusive thoughts. And there may be a number of different intrusive thoughts that you're working on, but also a number of different triggers. So at the beginning, we're still going to notice those unpleasant feelings, but we learn that these feelings aren't dangerous and that we can cope with them. I think that's the really key thing. I probably haven't mentioned us so far, is that those unpleasant feelings can be so anxiety provoking, so uncomfortable physically, emotionally, that we do start to believe that there has to be something wrong. There's something dangerous here in the way that I'm feeling, and therefore I need to do something with it. But this way of supporting ourselves and challenging our OCD shows that they aren't dangerous. and that I am able to cope. So we therefore focus on what we are able to do rather than what we're not able to do. And third, we may also notice that unpleasant feelings become less strong over time. Now, this might not happen for everybody, but as I said before, if we're exposing, it's like anything. It's like if you go into a room with a bad smell, over time you start to no longer notice it. It will be similar to that, not quite like that, but similar in that and not for everyone either, but if we expose ourselves to these intrusive thoughts, we sit with the unpleasant feelings without using compulsions, without avoidance, the emotions, the feelings start to reduce over time because we learn that we're safe, and therefore they become less strong. And then each time that we trigger that intrusive thought, it's just that little bit less unpleasant feeling. The intensity isn't as strong next time, and so on and so forth. So rather than a peak and a trough every time we trigger it, our anxiety peaks, it then comes down. Instead, we have a nice bell curve where, yes, at the start it does trigger and peak anxiety, but over time it reduces and stays low. So we're thinking about the long-term benefits here. Why ERP? What's the evidence? Well, ERP is found to be the best therapy for obsessive compulsive disorder. It's a therapy recommended by official NHS guidelines, which is the NICE guidelines. ERP is based on self-help, group and individual support, and ERP in all of those is effective and are recommended by NICE. So we use ERP because it can be used as a self-help technique. We give you the techniques to use. They can be used in a group scenario to encourage each other to support yourselves and to get other ideas of how to support yourself, and individual, all of them being effective. ERP is hard work, but it does work. The reason we use ERP is because, yes, it's hard, but it works. We see results. We have thousands and thousands and thousands of people have used ERP, and it has really worked for them. They are evidence-based techniques that really do make a difference. But the really important element of it, I suppose, in the effectiveness, is the commitment to it. Because it's such hard work, a lot of people struggle. A lot of people find it very daunting. And so I suppose our support in that is just as valuable, but we need your commitment to start off with. I think that's another element that offers with this just 2 workshop course, is that we can start to get you to sort of see the ideas of what you're going to be asked to do within ERP, so that we can ensure that you are committed to making that change, and so we can then really support you in moving forward. So really, really important to reflect on how committed you are to make these changes, because it will not be easy. So in the OCD Clinic, which is what we term for our support within the service, we provide ERP support materials. So that can be online or as a booklet. So we provide support materials alongside it. So we're not just expecting you to be able to remember everything that's said in sessions or in the support session itself. So you'll be given different tools, different materials to support yourself in making those changes in between. It's a step-by-step process. I think every technique that CBT uses is step-by-step, because actually, if we ask you to do all of it at once and don't take it in a step-by-step process, it's less likely to be effective. Because this workshop is step 1, understanding and reflection. We'll then move on to step 2 and so on. So it's a step-by-step process that we use within the OCD Clinic. You will then learn the skills to help yourself overcome OCD. We're ultimately trying to support you to become your own therapist. We want you to support yourselves. We're not going to be there forever. We can't offer ongoing support. So we need to make sure that the support that we do offer you puts you back in the driver's seat, puts you back in control. I know a lot of people that I've spoken to with OCD, they feel utterly out of control. I've got no control over this. I have no idea what I'm going to do. We want to challenge that. We want to show you that you are more capable than you give yourself credit for. I know I keep saying it, but it is true. It's going to be hard, but you can learn the skills to overcome OCD. So that's what we're going to try and support you with. And again, it's hard, but it works. So in the OCD clinic, we're not going to sugarcoat it. We're not going to say this is going to be easy, but by breaking it down by step, giving you materials and giving you the skills to help yourself, how it's going to be effective, that's how it's going to be. We're then there to support you in any of the barriers that come up, any things that get in the way, and things that you don't understand. You have that space to ask questions, so that ultimately then at the end you are your ultimate therapist. You know exactly what you need to do. So let's break that down even simpler. What are the steps that happens in OCD treatment? So first of all, we start by making a list of challenging ERP tasks. So we ultimately start to make a list of the different triggers, for example, you're going to need to expose yourself to. You then choose 2 or 3 of these ERP tasks and do them at least once a day. So we're really going in at least once a day, we need to be doing them. The sooner we get started, the sooner the change happens, but also we can't do this gradually. If we start doing it too gradually, it's not going to be as effective. So we need to do it at least once a day and repeat it. Repeating those compulsions, because we know they do us good, we need to repeat these ERP tasks to show that they make some beneficial difference, because initially we're not going to be able to see that. Or I suppose just by thinking about it, it doesn't necessarily seem like it will. We keep doing these ERP tasks every day. We then move on to do another 2 to 3 tasks from the list, keeping up the good work from the previous tasks. And that the time frame between that will vary from person to person, but then we move on. We pull from the list, we start with the other 2 to 3 tasks. Remember, we're going to need to drop all compulsive and avoidance behaviours, including mental ones, and ask other people to stop giving us reassurance, to stop doing things for us. So that's what these ERP tasks will involve. They'll involve triggering our impulsive thoughts, exposing ourselves, but then response prevention. So reducing the compulsions, reducing the avoidance. Remember, we're going to have unpleasant feelings. There's going to be anxiety, there's going to be disgust. And I think that's what we're really here for, is to support you with that, to offer you the space to share what you're feeling, to share how it felt, how hard it was, and to give you the support to keep trying. Doing it on your own, some people manage it, some people do, but actually it's far more effective if we're able to give you some sort of support. That being materials, step-by-step help, empathy, just understanding, in order to support you in keeping it going. But if we have those unpleasant feelings, this is a good thing. It means that we're doing the exposure. It means that we're also doing the response prevention. If you're not feeling anxious, it means we've missed something somewhere. So it means the treatment is working. We do really need to remember that at that stage, because I suppose when we're feeling it, it's going to be very difficult to remember that there's a reason why we're doing it. But there really is. It makes a big difference. It really, really works. That's it. I know it's a very brief nutshell about about ERP, but at this stage it really is just understanding what is involved, what we're going to be asking you to do. And ultimately we're asking you to trigger those intrusive thoughts, stop the compulsions, stop the avoidance altogether, straight from day dot, really, from the very beginning. And that's going to expose you to the unpleasant feelings and going to challenge the importance of those thoughts. So I suppose what I really encourage you to do is just reflect on that, not to make changes at this stage. And if you start to feel really uncomfortable when reflecting, like I said last time, don't worry, we are going to support you through this. and you're not alone in this. But if you can start to get your head around what we're going to be asking you to do, you are more likely to be more committed, and it's more likely to be effective. So remember, this is step one. This is understanding, reflection, so that then when we really get into the nitty-gritty of it, we can hit the ball rolling. So just to summarize then, I know I've said this a few times, but just as a reminder, workshop 1 was what are the symptoms of OCD, looking at obsessions, compulsions, and avoidance. We looked at different types of obsessions, different types of compulsions, different types of avoidance. Not all of those examples may have reflected everybody's experience, but they're a good bulk of them. And then we looked at the maintenance cycle. How is OCD maintained? In workshop 2, so today, we then looked at what helps with OCD. So we recapped workshop 1, but our main focus was to really focus in on what we're going to be asking you to do in order to make a change to OCD. What are you going to be involved in order to cancel out that anxiety and really take back control? In regards to next steps, so what happens after this course, everything will be explained in the emails that we send out to you or the correspondence that we send to you. So hopefully everything will be made simple and explained through that way. But if you do have any questions or any concerns, then you're more than welcome to get in contact with us and we'll talk you through that. Okay, congratulations, you've made it to the end. Well done. Thank you for sticking with me as I've taken you through this. I really do appreciate that we've gone through a huge amount. So I really hope that you found the sessions helpful. But I also appreciate that it could have been quite daunting to go through that amount of information all at once. To also start to reflect so much on our anxieties and our OCD can bring up a lot for us. So do make sure that you're kind to yourself following this course. Remember, and I know I keep repeating this, but it's really, really important to remember, is that this is the starting block. This is the first step. This course is all about helping you to reflect on your difficulties, reflect how potentially your intrusive thoughts, your compulsions, your avoidance is keeping the OCD going, and just starting to think about changing some of those elements. We therefore hope that these sessions will put you then in the best possible position to make the next steps towards being able to manage your OCD differently. But that's also what is also just as important is the support that we give you to do that. We are here to support you with that, and it's really important with different types of support we can offer to make you feel able to make that change. So we're not doing it for you, we're going to give you the skills to be able to do that, but you do need support along the way, or a lot of people do need support along the way, and we appreciate that as well. Okay, so before we finish, before I let you go, it can be nice to take away a reminder of how far you've come over the last 2 sessions, how much you've learned. So one last question to ask yourself is, thinking back over the course, what's the most important thing that you've gained from the sessions? Is there one thing that I've gone over, a particular part of the OCD cycle, something you've read on the slides that really stuck with you, that really felt, I suppose, really helped you to understand your OCD or to think about how to change it? Take a little bit of moment now, if you want to think about that. Thank you again for going through this. I really do hope that you found it helpful, and I wish you all the best with your progress moving forward. Take care, everyone.